I think because of the size of the practice, the number of physicians that are working together, we have the opportunity to bring some unique resources to patients. For example, in the Lax Cancer Center, we have a beauty clinic for patients who are going through chemotherapy, where they can get free advice from cosmetologists, have the hair shaved when they're going through chemotherapy and that loss. And those are free of cost to the patient. There are services with psychosocial counseling through the traumatic experience of cancer and taking that whole journey. And that kind of aspect is not present in all practices, and it's because of the sheer size of the practice that we're able to bring those things to the patients. I myself have a PhD in nutrition, and so I often talk to patients about how to modify their diet and lifestyle to help with possibility of decreasing recurrence of cancer, as well as managing the side effects of chemotherapy. Patient population here is very expressive of their appreciation of care, and they bond very tightly with the physicians. So that's incredibly rewarding to build relationships over time with your patients in oncology. Oh, I have two children who are incredibly active and wonderful. One is quite scientific, actually both are scientific, but one is particularly interested in genetics, so he's into breeding different kinds of chickens and fish, and so we have this little homestead farm thing that we're working on right now. Well, I think we have an influx of new targeted medications, and we have technologies that are evolving rapidly that help us to profile specific tumors to assess what signaling pathways may be dominant in driving a tumor. And now we have medications that specifically target those, that alleviate some of the toxicities of chemotherapy, which targets any rapidly cycling cell. So to see the field evolve from a non-specific toxic treatment approach to now more focused approach for given tumors and within subprofiles of tumors is really exciting. Like breast cancer in the last 20 years has turned from a lethal disease to more of a chronic illness.